Hi friends, today we are going to discuss about topic glomerular filtration. See, the first step in the urine formation is filtration of large amounts of fluid through the glomerular capillaries into Bowman's capsule. Almost 180 liters per day of this filtration occurs. Out of this, only 1 liter of urine is formed around. Okay. So, in the first step of urine formation is nothing but filtration of large amounts of fluid through the glomerular capillaries into Bowman's capsule, and almost 180 liters is filtered. Okay, right. Most of this filtrate which is filtered is reabsorbed, leaving only about 1 liter of fluid to be excreted each day. Although the renal fluid excretion rate is highly variable depending upon fluid intake. So, in general, out of this 180 liters of filtration, only 1 liter is excreted from our body in the form of urine. But this 1 liter is highly variable because if we take large amounts of fluid, the excretion may increase to 2 to 3 liters. So, it is highly variable and depends upon our fluid intake. And if we do not take much fluid and if we are dehydrated, even this 1 liter of excretion also will be decreased to 500 ml or like that. Understand? So this excretion is highly variable depending on our fluid intake. Okay, right. The high rate of glomerular filtration depends on high rate of kidney blood flow as well as the special properties of glomerular capillary membranes. So, on what factors does this glomerular filtration depends is the blood flow to the kidney. If blood flow is very sufficient and adequate, then the filtration will be normal. If the blood flow is obliterated due to any reason, then the filtration will be not there and the urinary formation will not happen. Okay, and this filtration is also depends upon the special characteristic features of the glomerular capillary membranes, which will be discussed in a separate video. Understand? Right. Next, glomerular filtrate. So, what is the composition of this glomerular filtrate and all we will discuss here. Like most capillaries, the glomerular capillaries are relatively impermeable to proteins. So, the filtered fluid called the glomerular filtrate is essentially protein free and devoid of cellular elements including red blood cells. So, here the filtration occurs at the glomerular level. So, here the protein should not be filtered, right? If the protein is filtered, what will happen? We will lose proteins in our body and it leads to several diseases. Understand? So the protein should never be filtered from the glomerular capillaries. So this is one of the characteristic feature of glomerular capillaries, why the proteins are not filtered. Okay, that will be discussed in the next coming video. Okay, and we know that even the red blood cells present in the blood are also not filtered. Okay, why? Because if the red blood cells are filtered in the urine, what will happen? Blood loss will be there, it will become anemic and eventually will die. So this is again a special property of glomerular filtrate, and how this happens will be discussed. The concentrations of other constituents of glomerular filtrate, including most salts and organic molecules, are similar to the concentrations in the plasma. So other than these two, mostly proteins and the red blood cells, remaining other most salts and organic molecules will be same as in the filtrate and in the plasma. That's what I want to convey. Expectations to this generalization include a few low molecular weight substances such as calcium and fatty acids that are not freely filtered because they are partially bound to the plasma proteins. And you know, calcium is also not filtered at the glomerular level because calcium is bound with the proteins. As proteins cannot be filtered, calcium also will not be filtered. Understand? This is what we need to remember. And we know that in chronic kidney diseases, so many patients will have a calcium deficiency and the bones also will become weak. So what is the reason is here the glomeruli, which actually prevents the filtration of calcium, will be lost, and due to some abnormal disorder in the glomerular capillaries, the calcium will easily pass in the urine, filtered and pass in the urine. So calcium will be less and bone resorption also occurs, because once the plasma calcium level is decreased, what will happen, the bones will start to release calcium from itself to maintain the plasma calcium level. So bones will become weak and they break eventually. Understand? So this one we have to remember. And the next, for example, almost half of the plasma calcium and most of the plasma fatty acids are bound to proteins, and these bound portions are not filtered through the glomerular capillaries. This is what I have discussed. Next, we'll discuss some little bit about glomerular filtration rate. Understand? Similar to other capillaries, the glomerular capillaries filter fluid at a rate that is determined the following. So, at what rate this filtration occur and how it is determined is, first one is the balance of the hydrostatic and the colloid osmotic forces acting across the capillary membrane. So, it depends mostly on the hydrostatic and colloid osmotic forces acting across the capillary membrane of the glomerulus. This is one of the important factor that affects the filtration rate. Second factor is the capillary filtration coefficient. What is it? The capillary filtration coefficient, the product of permeability and filtering surface area of the capillaries. So how it is calculated? The capillary filtration coefficient is, it is nothing but the product of the permeability and the filtering surface area of the capillaries. Okay, I'll explain this in coming slide. The glomerular capillaries have a much higher rate of filtration than most other capillaries because of high glomerular hydrostatic pressure and a large KF. So the filtration of these glomerular capillaries is very much higher. Why, other than other capillaries which are present in our body, why these glomerular capillaries have much higher filtration? So because of more or high glomerular hydrostatic pressure and large KF. In an average adult human, glomerular filtration rate is about 125 ml per minute or 180 liters per day. So per minute, how much it is filtered? 125 ml. Okay, right. The fraction of renal plasma flow that is filtered, right? The fraction of renal plasma flow that is filtered averages about 0.2, which means that about 20% of the plasma flowing through the kidney is filtered through the glomerular capillaries. So, the fraction of renal plasma flow that is filtered, okay, averages to about 0.2, which means 20% of the plasma flowing through the kidneys. Okay, so how much amount the plasma that is flowing in the kidney, okay, that is the blood that is flowing in the capillaries, how much amount it is filtered is not more than 0.2%, which means that 20% of the plasma flow the kidney is filtered through the glomerular capillaries. Understand? Only 20% is filtered. Understand? So these are the basic physiological things that occurs at the glomerular level, okay, in the Bowman's capsule of a nephron of each kidney. In the coming videos, we will discuss about the structure and the 3-layer structure of glomerular capillaries and how it determines the filtration and how it affects the glomerular filtration rate. Understand? Thank you for giving me this opportunity.